Carly, thank you so very much. Ronald McDonald House has a very tall task, creating a family environment while you are away from your home, providing relief for families whose kids, that's right, are receiving medical care. Michelle Horine, you recognize her, I know you do, with the nonprofit. You've been there over over a decade, 12 years. What a great opportunity for you with Day of Giving. Right now we know budgets are really tight, especially with the current environment we're in, if you will. The money that's raised, I'd like to ask you this, do you have anything in particular that you're going to use it for, or is it continuing with the development of your new house that you're trying to build?
Well, you know, every day at Ronald McDonald House, we have over 25 families that stay with us. Mm-hmm. We never ask them to pay for their night stay. So first and foremost, all of those funds go to operate our current operation of our program. Mm-hmm. As many know, we are in a capital campaign. I just told you we had 25 rooms. Yesterday we had 27 families on the wait list to get into our existing house. So we have more people needing a room than we currently have. So certainly we are focused on the capital campaign, mm-hmm. but for Coastal Bend Day of Giving, this goes towards operations. Our operation is going to be a little different in 2026. So the funds that we need for 2025, 2026 are going to be the transition period as we move into our temporary housing and prepare to build a new house. I
know a lot of families right now are worried about insurance, worried about this government shutdown, how it's affecting them. If you're dealing with insurance right now, and my family is with certain aspects, we're worried about this. Now we're having to worry about going out of our area to receive care. A large portion of the kids that y'all deal with, the families, are receiving care at Driscoll Children's Hospital, but the families need to be with them. The resources you provide, how invaluable is that to the families that are there?
Well, you know, you just think about your average bad day, right? Mm-hmm. Is nothing like our family's average bad day. They've found out that their child has a critical illness. They're going to need to be away from home. They may need to divide their family. If possible, we like to bring the family unit all together. Mm-hmm. We do find that being together is more healing for the entire family. So we're just so grateful that we have the quality care at Driscoll Children's Hospital. We're able to provide that extended care once they come home from the hospital. Then they come home to the Ronald McDonald House. That is their home. It's a different environment. It's not the hospital, institutional healthcare environment. It's where they come home.
It's not cold and all white walls. I mean, you're in a place where you feel warm and part of that family.
Well, certainly the hospital is safe and exactly what you want. But you always need to come home and figure out how you decompress, and that's what the Ronald McDonald House is. We are other families supporting families, staff supporting families. We're a 24-hour operation, 365 days a year, and we're there to support families who need to be, you know, close to their doctors and close to the critical health care that they need.
And you've expanded your resources to include the Valley as well. The last year or two, that was a part of the process?
In 2021, we merged with the Rio Grande Valley, and we became Ronald McDonald House Charities South Texas. So we do have programs in the Rio Grande Valley. We have 2 family rooms in Harlingen and Edinburgh. We also have a care mobile that provides dental health care and education. We've served over 800 families in the past 2 months. Wow. With the care mobile, and the prior house in the Valley was serving maybe 300 families a year. So we're proud that we're able to serve families throughout all of South Texas.
And as far as what's the turnaround? Like, families come in, they're there for a couple weeks? I mean, because you said there's a wait list. So I mean, it just depends on what process or procedure they're going through.
So every Ronald McDonald House is different. Ours is unique because of the care that they are getting at Driscoll Children's Hospital is an extended care. So our #1 diagnosis is cardiology. Over 60% of our families are staying with us, are staying for over 100 nights. Okay. So it's not 2 weeks. Yeah. It's imagine staying in a hotel room for 100, 200 nights.
And hence the money that comes in from Day of Giving is something that will greatly benefit that process, as you said, operating costs and making sure the families have what they need. We're going to put some information on the screen right now. There's a QR code. We've talked about it, the coastalbenddayofgiving.org. We're going to have a link on our website as well if you'd like to give. Michelle, always a pleasure visiting with you. You do such great work in the community. I know you were in news at one time, so I feel akin to you, but the work that you do is great, getting to help these families and provide that home away from home.
Thank you.
So, absolutely.